Hello everyone, my name is Siobhan and I am doing my presentation on Broca's aphasia. So Broca's aphasia is named after Pierre-Paul Broca, and he was a French physician. And in 1861, by doing postmortems on several patients that he had that also experienced similar language deficits, he was able to establish that there was trauma or a lesion or something was going on in this particular area of the brain, and that was the posterior inferior frontal lobe and central and inferior parietal region. And he was able to make the connection that expressive language was connected to this area of the brain. And here's a picture of the area, and they refer to it as Broca's area. So the causes of Broca's aphasia could be stroke. This is a big one. It's basically when the blood supply is blocked or cut off, and it is severing that area for making its connections to the rest of the brain. Also, there is traumatic brain injury, or TBI. So this could be from a fall, this could be from a car accident, motorcycle accident, any type of blunt force trauma that causes damage to that particular area. Brain infections, so encephalitis, meningitis, a brain abscess can also cause Broca's aphasia. And also there are tumors that can cause Broca's aphasia. It could also be caused by surgery to be done if they were having the tumor removed, if they do not make a successful incision, or if the tumor is really into the wall inside the brain, it can cause issues when it's being removed from surgery as well. So characteristics of Broca's aphasia: it is called a non-fluent aphasia. When someone is talking, they are leaving out words. What they are saying doesn't flow, it doesn't make any sense. One of the examples that they gave was if someone was trying to say there are two books on the table, the person would omit words and would say something like two table book. So it's not following any of the grammatical flow. It doesn't follow any of the rules for grammar, especially with spontaneous speech. This is severely diminished. So simple words that are making connections, so and, the, is, are being left out. So it's really making these sentences just blurts of words. Even though all of this is happening, typically comprehension is intact. So if someone is reading, they're understanding what people are presenting to them in written text. They are understanding speech. The deficit and the issue is when they are trying to get out or express their part for the language. So the ICF, International Classification of Functioning, has 4 central areas: health condition, body functions and structures, activities and participation, environmental and personal factors. So for Broca's aphasia, the health condition really is the aphasia. It's this inability to have proper or successful speech. So this is typically acquired in adults. This is not something that is developmental normally, and this is caused by traumas or injury or infections. Body functions and structures, so the capacity for successful expressive language, although comprehension maintains. This is the biggest issue. This is the deficit. There is an issue, there is a lesion, there is damage to this area of the brain, and it is not making the connection so that it can be expressed back out. Activities and participation are greatly reduced. Usually people will feel embarrassed or frustrated because they know what's going on around them, but they simply cannot engage appropriately or successfully, and that's really a big thing. So there's a lot of frustration, depression, embarrassment, and that can also play into the environmental and personal factors. This really has a huge effect on someone's independence, their confidence, and their eagerness or their motivation to engage with others. Because of this, a lot of people may struggle socially, or it could cause problems and frustrations within their families because they can't express what they need to, and as well as someone's career or their job and their livelihood. Thank you.